Hello everyone, I'm Dr. Sumina Reddy, fertility consultant and laparoscopic surgeon at Fertilica IVF, Hyderabad. And when you're going through patients, some people respond very well.
Correct.
Some people have a very slow response.
Yeah.
How do you deal with the slow response? And also many times patients are really agitated that there is no response that is seen in spite of doing everything that is being
Correct.
said.
Yeah.
So how do you deal with such people?
Yeah.
How do you make them stick to their healthy diet?
Yeah. So I think firstly I would thank you for it, because you are the one who motivates the people from the other side.
Yeah.
I think a lot of people, a lot of patients who've come to me have said, I've come only because of Sumina ma'am. She told me that diet's going to help me a lot, so I'm here. But part of, I think a majority part of nutrition therapy is also counseling. It's also being there for your patients, encouraging them to stay on track. And not all times do people see a weight loss reduction because of the hormonal changes that are happening in their body. But when we put it under a microscope and we look at egg quality, the AMH levels, micronutrient stores, insulin resistance, all of that improves with diet. So that itself is a battle won. And like you said, like a lot of people come with overweight, and they're like over 100 kgs, over 90 kgs, and we can't make them lose 30-40 kgs in 3 months.
Very true.
So we just focus on a 10% body weight reduction. So if they're 100, we focus on 10 kgs before we get started on their fertility treatment. Yeah. That itself boosts their chances of conception by about 65%.
So this is really true, and I truly believe that having a proper knowledge and knowing the science behind the diet and food we eat is really important.
Correct.
These days we have nuclear families everywhere.
Yeah.
And somewhere the couple don't have the support and knowledge that comes with the combined family, a traditional food value that comes in a combined family.
Correct.
Many people, both the husband and wife are working. They are tired by the time they come back home.
Yeah.
Nobody has patience to cook these days.
Yes.
We have easy apps. We have Swiggy. We have Zomato. People just order in food. That's good once in a while. But we really need to know what we are eating. I believe that food is also one of the most important medicine that goes into the body.
100%.
It's not just the medicines.
Yep.
So I feel somebody should guide them. Probably I may not be able to give so much time as much as you give in counseling them, making them understand what to eat, what not to eat. And I truly believe that many of my patients really benefited after meeting you.
I'm glad they have.
Yeah. So moving further, do you think that stress or lack of exercise also is going to have an impact on what they're eating or the response to food or diet they're following?
100%. So let's look at stress and exercise as individual components before we link them to diet and fertility, right?
Yeah.
So if a person is too stressed out, what might end up happening is their cortisol levels will increase. When your cortisol levels or the stress hormone, when those levels increase, there's a lot of internal stress that's happening as well. So there's a stress on egg quality, there's a stress on the endometrium blood supply, all of that happening internally. So obviously you'll have more acne, a lot of hair fall, you'll start heading into depression, you'll start having a lot of anxiety, as well as what happens is you lose motivation to work out. So that links it to workout.
Correct.
If you're stressed, you're not motivated enough to go for workout, you're not motivated enough to work at all. So what you do is you think that you'll go for a walk, but then you're like, no, I'm too stressed. I don't feel like doing anything. So now in these two factors, when you combine them with what you eat, right? So when you're stressed, a lot of people end up overeating. They overeat on the wrong foods.
Correct.
A lot of food from outside. And like you said, these home delivery apps makes it more convenient for them. And when they do that, they start seeing the weighing scale go up, and then they lose motivation to go work out because they feel like, what's the point of going and working out? I'm only gaining weight. And then again, going to the entire exercise point of view as well. If you don't exercise, you don't have a good appetite. You end up wanting to eat a lot of wrong things. Mentally, I feel exercise opens your mind up. It de-stresses you as well. So when you're thinking of exercise and stress, it's directly linked to what you're eating and your food choices, because you end up overeating on all the wrong food groups.
Correct. So there are few important points that are brought out here. One, the fertility and reproductive health when you walk into a doctor's chamber, it's not a magic or magic pill that is done.
Exactly.
There's no injection or tablet that we give to patients and you conceive the very next day.
Correct.
It is a holistic change that needs to come in your lifestyle, that is apart from the diet and medicines that the doctor prescribes. It is very important to follow good diet, reduce the stress as much as you can, and exercise every day.
100%.
The holistic improvement, apart from the reproduction, it does a lot of good to the general health as well.
Correct.
And another important thing, when you are going for dietary changes, exercises, the weighing scale is not the only indicator or parameter to tell whether it is working or not. The food, diet, and the good exercise, meditation, and the relaxation techniques you follow, they show impact at many of the micro levels, the hormone levels, or the egg quality, the sperm quality. So the scale is not the only parameter to judge the output of the good work that you're doing.
100%.
So yeah, let's move ahead. Is there any safe limit or safe amount of alcohol or smoking that can be done?
So alcohol, research says there is no safe limit when you're trying to conceive. Consumption of alcohol before you're pregnant and while you're pregnant, it basically increases your chances for preterm labor and miscarriages as well, or it could affect the baby's development too. So as a rule of thumb, I ask couples, both men and women, to refrain from alcohol consumption a minimum of 3 months before they're trying to conceive, only because the life cycle of an egg is about 3 months. So the alcohol that they've stopped taking 3 months before drastically improves egg quality.
Okay.
When it comes to smoking, again, smoking
No.
I think is like the
Big
biggest.
no.
Yeah, you know it
Of course, big no.
Yeah.
So there is no safe limit for alcohol or smoking. That includes and covers both men and women.
Correct.
It's not just for women.
Yes.
And also we know that the refined sugar, refined flour, as we spoke, all the white ones, and including the sitting, is considered new smoking.
Correct.
So avoid alcohol, avoid smoking, at least cut down the refined sugars and refined flour that you're taking, and be on your toes, walk around, be active as much as you can.
100%. I wouldn't have said it better.
Okay. So is there any special diet or magic diet that you prescribe for women undergoing IVF? Because IVF is considered that big step in the fertility journey.
Yeah. I wish there was a special diet. Like you said, I wish there was that magic pill.
Diet.
But unfortunately, no. When it comes to fertility or IVF as well, it's all about managing the symptoms and managing the major factors that come into play. Like you said, age is one of the biggest factor. So when you cross 32 or 35 years of age, the requirement or the supplementation of certain nutrients, that increases as well. And again, following the basic dietary guidelines when it comes to macronutrients such as low GI carbs, lean protein, healthy fats, a lot of fiber intake and antioxidant intakes, and not to forget supplementation. I am someone who's pro supplementation because I feel even though you give a patient like a balanced diet, sometimes because of some reason they are not able to have a meal and it sort of ruins everything. So I would give supplementation for people who are trying to conceive. And then whatever they're getting through food is a bonus. It's never going to go waste.
Any special supplements for vegetarians?
Good question. So these days we're getting a lot of vegan CoQ supplements, and some of them do work. The ones that don't have gelatin in them do work. The ones that don't have, that are not oil based, they do help as well. So CoQ that come in the tablet form, not in the capsule form, that is something that helps. Other supplements, again, when we talk about vitamin D, right, I would say sunlight. 10 minutes of sunlight every day, any time of the day, predominantly falling on your neck, is more than enough. Folic acid, like you said, super important. Vitamin E is something that improves egg quality as well. And I call extra virgin olive oil as the magical syrup for fertility, only because of its antioxidant content as well as its vitamin E content.
Okay.
In the Western countries, they literally give it as cough syrup for everyone trying to conceive. So I just ask people to drizzle it on their food because Indians don't like the taste of olive oil.
Olive oil, that's true. and any dietary changes in the pre-embryo transfer phase or the post-embryo transfer that we need to do to improve the implantation rates?
Yes. So when we're talking about endometrium thickness, right? So the endometrium thickness is the most important aspect of implantation along with internal inflammation. So when we're looking at endometrium thickness, the major, I would say 90% is dependent on whole grains or whole foods as well. So when we talk about whole grains, we mean red rice, we mean wheat, we mean what else? Godum rava or dalia or wheat rava is what we call it. A lot of millets, so whole grains rather than grains that are refined or broken down. This is something that improves your endometrium thickness by almost 40%. So a lot of women, by just including whole grains thrice in a day, is something that they found that would improve your endometrium thickness. And when it comes to blood supply, obviously it's omega-3s again, vitamin E. So omega-3s, when we say adding a lot of nuts, a lot of seeds, even just sprinkling flaxseed powder on top of your foods or adding flaxseed powder to your chutneys on a daily basis, that is something that helps. And vitamin E, usually I tell people to take a supplement for vitamin E, especially 15 days before the embryo transfer. Post embryo transfer, we try not changing too much. We ask them to continue with whole grains. A lot of people feel that if they put their legs up and sit for at least 5 minutes in a day, it will improve their chances, but that doesn't work. A lot of people feel going for runs after that will also help, but we ask people not to start any new exercise.
Like not just to do anything new.
Correct. Just continue with what they have been doing.
True.
More than enough. Nutritionally, post-embryo transfer, there's nothing in our hands. It's all about genetics. It's all about what you do.
And of course, it's about the body, how it responds and accepts the embryo.
100%. Yeah.
All right. So we had a very good discussion about the importance of diet in reproductive health and the importance of what food groups to include in your diet when you're looking for a good IVF cycle or a good reproductive health. So let us continue this talk further.